Hello, my name is Kenzo Sanga. This presentation is for Fort Hays State University for Nursing 809. The purpose of this presentation is to discuss the current statistics and science of hand hygiene. Also, I will be presenting the planning, execution, and evaluation of my community project. Wash your hands. Washing your hands reduces diarrhea-related illnesses by 31% and reduces respiratory infections by 16% to 21%. Great news, right? But, according to a study done by Harris Interactive in 2010, only 82% of Americans actually wash their hands. This is a quote from the American Society of Microbiology. Only 24% of men and 39% of women admit to always washing their hands after coughing or sneezing. Yikes is right. In 2010, Harris Interactive observed around 6,000 individuals in 4 major cities: Turner Field in Atlanta, Museum of Science in Chicago, Grand Central Station in New York City, and Ferry Terminal Farmers Market in San Francisco. Observers discreetly watched and recorded whether or not adults using public restrooms actually wash their hands. 90% of women observed washed their hands, compared to only 75% of men. They also conducted a telephone survey sampling around 1,000 Americans. 91% admitted to always washing their hands after using the public restroom. The goal of this project is to educate a community in Yorba Linda, California about hand hygiene and proper hand washing techniques. This will be conducted by having a health fair specifically focused on hand hygiene. The target population is everyone because children, adults, and the elderly can learn and benefit from proper hand washing techniques. The intended outcomes for the project are: number 1, participants of the fair must demonstrate proper hand washing. Number 2, complete a short post-test to validate understanding of hand hygiene. In order to measure the effectiveness of the education, we will have a pre- and post-test, as stated earlier. They will test the knowledge the community member has regarding hand hygiene before the health fair and after the health fair to reassess. Also, each participant will get the opportunity to demonstrate back to a healthcare provider at the fair how to properly wash their hands. What is the value of this project? Hand washing is the most cost-effective public health intervention that can decrease the incidences of diarrhea and respiratory diseases. Promoting hand hygiene only costs $3.40 for every disability adjusted life year, or DALY. DALY is a measure of overall disease burden expressed as the number of years lost due to ill health, disability, or early death. One DALY can be thought of as one lost year of healthy life. So for example, hand hygiene only costs $3.40 American dollars to avoid one DALY. Now that's the biggest bang for your buck. Also, according to a study conducted in 2017, India can save up to $5.6 billion just by conducting hand washing educational programs, thus reducing diarrhea and acute respiratory infections. Same study was done in China, and China was projected to save $2.6 billion. Now that is a lot of money saved. Education is the primary intervention and tool of this project. Proper hand washing is key. There are 5 steps to properly wash your hands according to the CDC. First step, wet your hands with clean, running water. Warm or cold is fine. Turn off the tap and apply the soap. Second step, lather that soap on your hands by rubbing them together. Be sure to lather the backs of your hands between your fingers and under your nails. Third step, scrub your hands for at least 20 seconds. Do you need a timer? Hum the happy birthday song from beginning to end twice. Fourth step, rinse your hands well under clean running water. Then the final step, dry your hands using a clean towel or air dry them. Things to consider for this project. The Triple Aim Experience. Does this project improve population health? Oh, you bet! It decreases diarrhea and respiratory diseases and the spread of germs from person to person within the community. Does it reduce healthcare costs? Heck yeah! As stated earlier, hand washing is the most cost-effective public health intervention that can decrease the incidence of diarrhea and respiratory diseases. Also, it will reduce the costs related to diarrhea and respiratory infections. And finally, does it improve patient experience? Absolutely. This project will be conducted in their community with interactive education, Q&A session, and healthcare professionals being around them, answering all their questions, and demonstrating hand washing. During the implementation of this project, the 6 IOM aims will be met and kept in mind. To provide safe interventions, to effectively teach hand hygiene, to deliver patient-centered education, to provide timely teachings and interventions, to efficiently educate the community, to deliver equitable care and resources regardless of race, ethnicity, gender, and income. Participants of the hand washing health fair will complete a pre and post tests about their knowledge of hand washing. The pre-test will determine what their baseline is and what they currently know. The post-test will be given after the event, after they've learned all the information from the health fair. The anticipated outcome is that the majority of the participants will score 80% or higher on that post-test. Also, participants will be asked to volunteer to demonstrate proper hand washing techniques back to the teaching healthcare provider. The anticipated outcome for this? 51% or more of these participants will be able to demonstrate it correctly. Plan, Do, Study, Act model was the continuous quality improvement model selected for this project. It is a simple, solid plan to evaluate the hand washing health fair. Plan it, try it, observe the results, and act on what is learned. Very simple, very effective. Planning the event, trying it out with a different population, different members, and different community members, observing the results from the post-tests and the demonstrations, then acting on what is learned and the results from those tests and demonstrations. This education type program through community health fairs can be conducted by every public health department. These types of projects can be done in public parks or in medical facilities, and these programs are targeted towards the community for all ages. Thank you for taking time to listen to this presentation. I hope that the presentation taught you something about the importance of hand washing and hand hygiene, and that I presented the current data and science of hand washing and how it can reduce diarrhea and respiratory related illnesses within the community. I hope that you were able to follow the planning stage, implementation stage, and evaluation stage of this project. Thank you very much.